The fentanyl overdose crisis is now one of the leading causes of death among adolescents, and it's happening in every corner of the country. Stay with us as we talk about the state of the crisis and the steps we can take to save lives.
I'm Dr. Josh Fader, the editor-in-chief of the Carlat Child Psychiatry Report and co-author of the Child Medication Fact Book for Psychiatric Practice, 2nd edition, 2023, and the other book, Prescribing Psychotropics.
And I'm Mara Governman, a licensed clinical social worker in Southern California with a private practice and an avid reader of the Carlat Psychiatry Reports. Today, we're addressing an urgent public health issue affecting our youth: the fentanyl overdose crisis. The statistics are alarming. In the U.S., there are over 100,000 drug overdose deaths each year, with opioids accounting for a large portion of these cases. Dr. Fader, could you provide an update on the current state of fentanyl overdoses among adolescents?
Mara, it's one of the largest public health crises we've ever seen. Overdose deaths among teens have increased, get this, more than 100% since the end of 2019. Right now, opioid overdoses are the third leading cause of death in adolescents aged 14 to 18, right behind firearms and motor vehicle accidents. At the very beginning of my career, Mara, I thought I was going to go into substance use. You know, my career has been mostly trauma and autism, and I do a lot of that work. But the reason was because even back then, we're talking about the early 90s, we had problems then, and it's so much worse now. At that time, we were working with kids to try to help them role play, how to say, I don't want this stuff. It was in the age of just saying no.
Say no.
If you remember this, there was millions of dollars poured into that program, and it turned out it didn't really work because it was a message without a methodology that could be shown to actually help kids to withstand the pressure from peers. But the role playing that we did, it was called the Drugs and Kids program, was adopted by the American Bar Association of all places nationwide. I think it went on to, live for a while. I don't think it's around anymore. But the point I'm trying to make is that this problem has been with us for a very long time. And now it's really amplified by fentanyl in particular.
You mentioned fentanyl specifically. How exactly is this affecting our youth?
Well, it's often accidental. They're popping a pill thinking it's something like Xanax or Adderall that they bought, off the street or from a friend, but it contains a deadly dose of fentanyl. Teen can take one pill and it can end their life.
So in a way, it's not even about substance use disorder for many of these kids, right? They're not necessarily seeking opioids.
The largest group of teens overdosing are those who aren't using opioids by choice. The second group is teens who have mental health struggles, anxiety, depression, ADHD, who might be more vulnerable to trying substances as a way to cope.
I treated grandparents who lost their granddaughter who took a pill at a party, who didn't know what it was or where it came from. And tragically, she overdosed on fentanyl, then died.
In the deaths in my clinical practice over the past 3 or 4 decades, early in my career, I didn't see overdose deaths. Now, all of the losses that I've had in my practice, and I'm an old guy with a fairly big practice, have been overdose deaths. And all of them, I think, have been accidental in every single case in the past probably 15 years. So it's horrible.
Yeah, in this age group of being impulsive and risk-taking and being at a party and not taking the time to think about what they're doing adds so much to those statistics.
That's right.
And this doesn't just affect one group of teens, right? There are certain populations that are hit even harder than others.
Yeah, Native American and Alaska Native adolescents have the highest overdose death rates, about 80% higher than white teens. And Latinx youth are also more affected than their adult counterparts. In certain parts of the US, like Arizona, Colorado, and Washington state, overdose death rates among teens are twice the national average.
And where are they getting these pills from?
Many still get them from family members or friends. Even though opioid prescriptions are falling, there's still easy access to leftover medications at home. That's why it's so important for clinicians to have conversations with families about safe medication storage and disposal, right? Like you go to the dentist and they automatically give you an opioid prescription to, ease the pain, whatever. They don't even have to do that. I mean, they probably ought to be just recommending Motrin in almost every case or some other kind of NSAID. And yet people, maybe they use them, maybe they don't. They're lying around and then people find them and then they use them and then they get addicted.
Or overdose.
What
are the strategies can clinicians use to prevent these overdoses?
Well, harm reduction is really, the most important thing. We are seeing people using more Narcan, which is great. And teens need to be trained how to use it, just like adults, especially at schools and things like that. They need to know how to use it. It's got to be on hand. But also talking about the risks in schools and at home and in healthcare settings, keeping that message vibrant and alive. It's not a one-time conversation. We need to talk about things like the danger of using drugs alone and recognizing overdose signs. And it's important for teens to learn how to use fentanyl test strips. You're going to take a pill. I don't want you to take the pill, but you should be testing it for fentanyl so that you don't die from using that pill that you bought from your buddy and you thought was just fine.
So are you suggesting that parents have that hard and difficult conversation with their adolescents?
Well, look, in every appointment with any tween or teen, right, I'm thinking about the big categories of things we should always be talking about. How's it going at home? How's it going at school? What's happening with activities and friends? What about substances have you been, exposed to, or what are you trying? And what's happening with, dating, intimate relationships, stuff like that. We should be having those conversations every time we see them, modeling that. And when we talk to parents saying, these are the things I talked to your kid about, and you need to be, kind of checking in with them as well. And I know they don't want to talk to you, but actually opening up that conversation is useful, and kids will often tell you things that you otherwise wouldn't know. You certainly won't know if you don't ask.
These are the tough topics that you're talking about with your teens, but how do you do it in a way that resonates?
Motivational interviewing is about building trust, listening to a person, hearing their story, finding out what they want for their life, and then meeting them where they are, not just telling them what to do, right? So they want to, be really good at sports, maybe play college sports. So what'll help you do that? What's going to get in the way? Are you worried that the weed is going to get in the way? Are you worried that the alcohol is going to get in the way? Are you worried that, the fact that you're, kind of finding pills from friends, might get in the way? Same with opioid use, obviously, as well. Though typically when we're seeing those kids, their grades have already dropped and, we're doing other things, maybe at a more intensive level of care to try to help them out. But in any case, you try to figure out what their goals are and then collaborate with them to try to help them to reach those goals so they feel like they're making a decision to change, not being forced into it. So we put out a motivational interviewing webinar having to do more with weed at Carlat probably a year ago, something like that. And I had like 7 or so case examples. And one that comes to mind is a kid who really just wanted to smoke weed and go to high school and be with his girlfriend. And that's kind of it. That's all he really wanted to do. But, I've stuck with him. And over the past year or so, we've worked toward a place where he's now out of high school and is reduced and stopped alcohol and is reducing his weed because he's decided he actually likes the work he's doing and wants to improve on that and maybe even get an education surrounding it. So it can happen. It's not easy, right? You got to stick with people, but it can definitely work.
You also talk about the educational component of drug use, because the weed that they're selling today is so much stronger and might be full of chemicals. And I think this generation is really focused on having something that's whole, that's organic, and that might also change their opinions about what they're smoking and what they're drinking and what they're ingesting.
I think that's true to a degree. And then I think there are people, I mean, you're right, it's so much stronger. It hits so much more quickly that people get what they want out of it. They feel, different, better, in their own opinion, often like really quick. They may or may not be thinking at that age about, the adulterants that are in it.
Also, the neuroanatomy of how it impacts a young brain.
Oh my God, right? I mean, it messes up your memory, and of course it reduces your motivation. And then there's the medical stuff that happens too, right? The stomach aches, people coming into the ER for stomach problems. Oh, yes, of course, the pulmonary problems as well. People saying, oh, it's weed, it's not going to hurt it does. And the vaping just as bad or worse.
And with teens, these conversations really matter, right? The adolescent brain is still developing, as we mentioned, and that can impact how they perceive risks.
Yeah, or not perceive them, right?
Perceive risks.
Their prefrontal cortex is still, developing, and they're not there planning ahead. I mean, that's so much of the problem. We can get people safely into their early 20s. A lot of times you get more myelination, right? And people are making better choices. So in the meantime, they're craving rewards. They're testing their limits. They're grappling with this high sense of justice and autonomy all at the same time. But, parents can actually leverage some of that to encourage better decision making, kind of like what you're talking about in terms of like food safety justice. You know what I mean? Like, we shouldn't have these, bad things in our food, and teaching them as well as we can, right, how to navigate peer pressure and support, positive pro-social behaviors whenever we can. And that often means helping people engage in pro-social activities. Maybe it's taking care of, other students who need mentoring or, things like that, coaching other kids. Those kinds of responsible roles can be helpful.
And it sounds like this takes a village, parents, clinicians, and the community all working together.
And that's why it's important to have places with interdisciplinary teams to support these teens and their families. Peer recovery, coaching, therapy, medication management. It's a holistic approach. It's not something that happens overnight, like we talked about. But over time, with sustained support, we can make more progress. Mary and I were just talking a little bit earlier about some of the cases that don't work out. And I think it's probably worth talking about these. I've got a kid who has, anxiety. He's been self-medicating with alcohol and weed for a long time, and we are not getting anywhere. And I really worry about the long-term impact on this kid of where it's going to go. There have been family members who have really suffered consequences as adults because of their continued use. And we can't always win these battles, but you got to kind of try. And, part of what we talk about in this issue of the Carlat Psychiatry report that is, for the winter of 2025 includes this piece on the fentanyl and opioid overdose crisis, and also a piece on nicotine. Maybe we'll do a podcast on that.
Yes.
Because, one of the things about these conditions is that, you win some and you lose some, and you're going to lose some in this case, but that doesn't mean we stop trying. If we give up, we'll lose a lot more. So that wraps up today's episode. Not a very happy episode on the fentanyl overdose crisis affecting our youth. It's clear that this issue needs urgent attention from all of us, clinicians, families, and communities working together to make some impact. The goal is to reduce stigma and get teens the support they need to stay safe and to thrive.
Absolutely. And if you're a parent, educator, or a healthcare provider, we encourage you to have those open, ongoing conversations with your teens. And of course, make sure you have Narcan on hand, because one life saved could make all the difference.
Dr. Erin Quiggle's interview in our January, February, March 2025 newsletter is the inspiration for this podcast, and it contains additional resources on how to prevent overdose and educate others. If you found this episode valuable, please share it with others who need to hear this message.
Everything from Carlat Publishing is independently researched and produced. There's no funding from the pharmaceutical industry.
Yes, the newsletters and books we produce depend entirely on reader support. There are no ads, and our authors don't receive industry funding. That helps us to bring you unbiased information that you can trust.
Remember, we're all in this together. Stay informed, stay engaged, and let's continue the conversation.
Thanks for tuning into the Carlat Child Psychiatry Podcast. Until next time, take care and stay safe.
Thanks for watching. Hit subscribe if you enjoyed this content. And to earn CMEs for listening, head on over to thecarlatreport.com/podcast.